Can you do anything about cartilage damage in your knee? I'm Dr. David, orthopedic surgeon, sports medicine specialist, and author of That's Gotta Hurt, The Injuries That Changed Sports Forever. And I provide education, information, and commentary on all sorts of sports and exercise injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. One of the biggest challenges we've had in orthopedic surgery is making cartilage new again. That's the white stuff on the end of a chicken bone, so to speak. That is it's a shock absorber. It helps to lubricate the knee or the shoulder through a range of motion, but that's what breaks down in arthritis. So if you have a small area of cartilage that's damaged, what do you do about it? I'm going to discuss options in this week's Ask Dr. Geier video. Matt in Los Angeles asks, can you possibly address my specific case either in writing, podcast, or YouTube? It would be very much appreciated. I got my MRI back and the findings are as follows. Approximately a 4 by 5 millimeter focal full thickness cartilage defect in the posterolateral tibial plateau with underlying subchondral marrow edema. Is this a big defect? Would you operate on it? My options for cartilage surgery all seem very daunting with significant rehab time of 4 to 6 months. I've laid off of it for 6 weeks, no exercise with zero relief. I'm 38, male, live an active life, and I'm in good shape. Well, there's no easy answer to that. And before I go into this, I want to make sure people watching this, not just Matt, understand that any of these questions and answers I give are not specific medical advice. I can't do that because I haven't seen you and examined you and looked at your studies. This is all meant for general information and education. And that's what I want to do here is give you some information about cartilage damage. Typically, when you have a small defect, less than a centimeter in diameter, so 4 by 5 millimeters would certainly fit into that, you try to get people better without surgery first. It may be physical therapy. It may be injections of various kinds. Yes, it may be activity modification, and the vast majority of the time that's enough to get it better. It doesn't make the cartilage heal necessarily and doesn't make the cartilage new again, but if it makes it even less painful so you can get back to what you want to do, that's certainly a good thing. Because even with cartilage damage, you can essentially not really have any pain from it. It's not at all uncommon that somebody comes to the office and they just started developing knee pain, but on x-ray you see that they've got pretty bad arthritis, and yet they're shocked. They're like, how do I have arthritis? I've never had any problems before. So just having a small area of cartilage damage doesn't necessarily mean you need to have surgery. The question gets to, though, what do you do if it's not getting better? Do you try things like injections or, do you try things like surgery? Well, as he alludes, there aren't really easy options. Going in and scoping the knee and cleaning up the area of cartilage damage hasn't really been shown to be terribly effective, quite honestly. If you look 3 months or a year or 2 years later, really not that much better than you were before surgery, so we usually don't start there. Some of the other things we think about are microfracture, where we poke small holes in the bone with what looks like a fancy ice pick. For a small lesion, that may be a reasonable thing to try. There are some questions about how well that does long term, and that's still a long recovery. There are things like these ACI, chondrocyte implantation surgeries. There's Oates procedures where you transfer cylinders of bone and cartilage either from your knee if it's small or from a donor if it's big. All of those are potentially possible, but all of those can be 6 months or more in terms of rehab time. People ask about things like PRP and stem cells. That might be a reasonable thing to try. The easy answer is that it's not an easy solution. This is something you really should talk to your doctor about, explore all your options, maybe try some of the non-surgical treatment ones first before heading into surgery for cartilage damage. Okay, was this video helpful to you? And do you have cartilage damage and you're wondering what to do about it? I'd love to hear your experience. Share it below this video. I know people dealing with cartilage damage all over the world would love to hear your experience as well. If you like videos like this and you want more information on sports and exercise injuries and injury treatments and injury prevention, subscribe to my YouTube channel. Click the button in the upper right corner of the page. I record 3 of these videos every single week and I'll deliver them directly to you. Thank you so much for watching. I really hope this was helpful. Remember, if you have cartilage damage, share your experience or share this video with somebody you know that's dealing with cartilage damage. I look forward to seeing you right here next time.